In 2018, RadNet Imaging and Memorial Care formed a joint venture for outpatient imaging services in Orange County. This joint venture comprises of over 30 outpatient radiology centers. The new name for the joint venture is Wave Imaging. Most recently, they added Orange County Diagnostics, or OCD, Laguna Woods, to their family of centers. The new name for the Laguna Woods location right down the street is now called Wave Imaging Laguna Woods. Today I have Dr. Gary Levine, Medical Director of Memorial Care Breast Centers. Thank you for joining us.
Thanks for having me.
So let's talk a little bit about the collaboration that is between RadNet, Orange County Diagnostics, and Memorial Care.
Right, this partnership has been very beneficial. It's really allowed the formation of 30 plus imaging centers throughout Southern California and really improves access for patients. They now have a lot of choices in terms of convenient options to obtain imaging.
Now, they used to go to BreastLink as well as Orange County Diagnostics. So now how does that change?
Right. In terms of specifically breast imaging, there now is Memorial Care Breast Center at Saddleback, which the former BreastLink and the Orange County Diagnostic Imaging have folded into. So now all breast imaging will be done at the Memorial Care Breast Center at Saddleback.
Okay, all right, great. And then, so now where they're going for the mammograms and breast ultrasounds is at that one location?
Correct, on the Health Center Drive on the Saddleback Medical Center campus.
Okay, great. And what about the new technology that is here now, which the Memorial Breast Center is offering? We've got mammography that's using 3D imaging and tomosynthesis, is that right?
Correct. Yeah, really, this is the new standard in mammography. It's called 3D tomosynthesis. Our radiologists were involved in the development and the research and testing behind tomosynthesis, and it really is the new generation of mammography.
Okay.
The technology involves multiple projection images of the breast from varying angles. Those projection images are compounded into a three-dimensional representation of the breast. So now the radiologist can look through the breast at 1 millimeter intervals to find a breast cancer that otherwise might be hidden within dense breast tissue.
Okay, and has that been around a while?
We did the original research back in 2009, 2010, but it's now starting to be available at breast centers throughout the country. We, again, are leaders in that field.
Okay, and what if somebody has a breast implant? How does that change?
So implant imaging isn't affected by tomosynthesis, so we can now see around the implant, make sure that we identify all of the breast tissue, and we're able to search through that breast tissue to potentially find an abnormality that otherwise would be obscured.
Is that something that's just automatically done now, that kind of technology?
We use 3D tomosynthesis more and more. It's most beneficial for women with dense breasts. Okay. Women with fatty breasts can still have the traditional 2D mammogram, and it's highly sensitive and effective.
Okay, great. And then how important is it for women to have yearly mammograms?
So the idea behind mammographic screening is to be able to detect breast cancer early before it's palpable and would be found by the patient or her physician on clinical exam. And the research has shown that if we can find breast cancer early when it's non-palpable, it's an extremely curable disease, usually with limited surgery.
Right, and there's been some discussion about age, like when do you start? Because I know that has been varying over the years.
So it used to be that we recommended a baseline mammogram at age 35 and annual mammography after age 40. Now the baseline study has really been moved to 40. Some patients may elect not to start screening until they're 50, but we do recommend starting at age 40 and having annual mammography afterwards. It's an important statistic that 25% of the breast cancer we diagnose are in women under the age of 50. So it makes no sense to us to wait to begin screening till after age 50.
Is there any particular age of when you stop having mammograms?
So really it has to do with the patient's physical status.
Okay.
And if they have a likelihood of living an additional 5 to 7 years, we recommend that they continue mammographic screening. If they have other medical problems, which makes their life expectancy short, then it really makes no sense to screen any longer.
Is there anything else that you'd like to add to tell our viewers?
You know, the fact is that we have no way of reliably preventing breast cancer from occurring still. The key to surviving breast cancer is early detection, and the best manner to detect breast cancer early is through regular mammographic screening.
Right.
We encourage patients to come in once a year for their routine exam. We have a very easily accessible facility with ample parking, the latest technology, and we have dedicated breast radiologists. These radiologists aren't reading a CAT scan of the brain in the morning and then an x-ray of the knee and then fitting in a mammogram. Our breast radiologists are dedicated breast radiologists. They've had subspecialty training and experience, and that's all we do, and we do it better.
Okay, well, thank you very much for the information.
You're welcome.
I appreciate it, and congratulations on the collaboration.
Thank you.
All right. Transportation is still provided for Laguna Woods residents by taking the East Bus to reach the medical center on Paseo de Valencia. And you can also use Plan a Ride, which is available from 8 a.m. to 9 a.m. or 5 p.m. to 10:30 p.m. weekends and holidays. For more information, call 949-597-4659 or email them at ride@vmsinc.org. Thank you for joining us.